Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And I am so excited to chat with Anna Maria Rossetti today. And Anna Maria, welcome.
Thank you. I'm so excited. Thank you.
It's wonderful to have you here. You are, of course, a presenter for our upcoming Gold Midwifery online conference of 2025. And your topic is Distress in Labor, a Psychoneuroendocrine approach. Ooh, that's a topic I can't wait to talk to you about. But first, let's chat a little about you. So you are a midwife. You are in Italy. Talk to us a little bit about your background here at this time.
Oh, yes. I'm so thrilled of being in Gold Midwifery. First, I have to say this because I've looked for you. And no, I've been a midwife now for 20 years. Of course, my training as a midwife was in a big hospital in Milano. We used to have like 7,000 births per year. So it was big hospitals with a lot of pathology and a little physiological births. And when I decided I needed to learn more about physiology, I turned to this postgraduate school in Florence that was founded by Verena Schmidt. Verena Schmidt is an Italian midwife who founded this school and a small editorial board so that we could learn more about physiology. And she was the one introducing me to the psychoneuroendocrine immunology applied to midwifery care. And so I started my journey helping mainly women during difficult labors, induced labors, or pathological pregnancies. That was my main thing as a midwife. I then turned to missions. I was in Afghanistan working for an NGO, a non-governative organization in a small city, a small village at the border with Pakistan. And when I came back to Europe, I decided I wanted to experiment different approaches. So I went to UK. I've worked there as a coordinator midwife in a small midwives-led unit. And then I was back in Italy to be an independent midwife and do home births. So I had the chance to, connecting the dots of how psychoneuroendocrinology applies to different settings and different needs for women, birthing people, and families. And so this is my area of interest the most. We know that birth and labor can be very difficult, and in the industrial world can be even more difficult than usual. And we have a little understanding in our universities and our textbooks. We have little understanding of how the brain and the environment affect the biological process of birth. So.
Absolutely. You're so right about that. And talking about your background there, right? Like you've been in many different settings, and also speaking about your experience there in Afghanistan, you saw probably a lot of stressful situations for, women giving birth there. And then your education with looking at the, psychoneuroendocrine connection there. Talk to us a little bit about what that is actually. What is the psychoneuroendocrine approach that you will be talking about? So we know, give us a little definition here.
Yes, it's a very long and difficult word. Psychoneuroendocrine immunology is actually the longest word in the Italian dictionary. So it's not so pop to speak about this, but it makes sense. If we think at the very message it gives us is that our body responds to our thoughts and emotions biologically and to the environment we're in. And also hormones can create thoughts and emotions and vice versa. So thoughts and emotions can produce in our body certain hormones. And if we think about maternity, so pregnancy and birth, they thrive in the prevalence of bonding hormones like oxytocin, hormones of love, like endorphins, the natural painkillers. And these hormones will work together with a certain state of our autonomous nervous system. So that part of our nervous system that we cannot control. Mm-hmm. So it's a very instinctive behavior of our biology. And even though we are not, we consider ourselves evolved mammals, still there are certain channels of interactions in between the environment and our biology that are very true today. And so if we look at the connection in between thoughts, emotions, environment, and how the uterus and the fetal placenta system thrive or are hindered by, pregnancy and during labor, we can approach differently pregnancy and labor and birth. We can approach by not considering, so when we have a difficult labor, we tend to think that that cervix is not opening, that baby is not rotating. So there's always some part of the woman body or the baby to blame. But if we could just consider our role as an environment, and I think what psychoneuroendocrine immunology teaches us is that the body is always right. So it's a difficult labor is the body responding to certain stimulus. And so we want to figure out what the stimulations are, where they come from. Do they come from the external environment? Do they come from the internal environment? Thoughts, memories, past experience of traumas. Where is it coming from? Because the body is responding in a way that is proper to our survival. It can be with the bonding hormones and neurovegetative fibers, or on the other side, it could be on the fight or flight system.
Right. And so what do we do then with that information? So once I love how you said we always end up, have blamed the body or blamed the baby, or the baby's not rotating, the cervix is not opening. So when we look at now the environment or what is going on there, okay, we have that information now. What do we do with that information to utilize it?
Well, there are different levels of what we can do with this information. The first thing first should be to know these informations, so that we can also listen in ourselves. How does this make us feel as professionals, as caregivers during labor and birth? Because it's a shift in paradigm. So we are involved. As if we take care of labor, we are the first environment of that labor. The second level of what we could do is to gain different tools to how to help a difficult labor instead of forcing the system, augmenting the contractions and trying to rotating the babies or putting the woman in fancy positions to make the baby turn or descend. What if we could use the inner resources of the body, i.e. the parasympathetic system and the parasympathetic terminations in the sacrum, in the pelvis, in the uterus, activating them with touch, with techniques, and some of these I have some videos in my presentation of. And how to rebalance the system, so system gain different stimulations and opens up. And then, of course, there's a third level of what we can do with this information, how we can change the narrative around birth and around that.
Love that. Change the narrative. I love everything I'm hearing here from you, and I can't wait for the presentation. I have that question for you. Many of us know, yes, the love hormones, oxytocin, how wonderful is that in labor and creating that environment. Now, what I'm very curious about when this is your presentation about distress, and you mentioned distress, in your answers here before. Distress is a very different situation, right? And it requires from the midwife also, being quick on her feet, thinking, evaluating, making, choices and not waiting too long in certain situation. How do we integrate what you just said in stressful situations so we kind of keep our cool, but still being able to make the right decisions and move forward without waiting too long or over hastily creating chaos when it's not necessary. Can you talk to me about this one a little bit?
I think this goes back to how do we see birth? What do we look at when we look at birth, and how that make us feel? Because if we perceive the woman's body, the birthing person's body, and the baby as objects of our care because they have to be adjusted to function, then what we perceive in ourselves is that we have to adjust, we have to fix it, we have that kind of responsibility. If we shift the paradigm and we think about the birthing body, the birthing person being full of resources, and so what we do with her is ask open questions and together shape the kind of care that she needs. And sometimes small acts can really have a ripple effect on the entire system. And so when we have chaos around, this is generally what happens. That I've been working in very rough settings, hospital settings. If we keep our focus on the person, her own experience, it's not just is how this distress is working on her system, on her perception of herself, on her story. And this can shape our intervention in a very personalized way. Yeah. And it is not, I used to say what Verena Schmidt taught me is that we do what we can with what we have in the time that we can. And this is my mantra every time I have to take care for a person with a difficult labor. It doesn't have to be ideal. We would love to have it ideal, but it's not. Nevertheless, inner resources of the body are always present. So just focus on them.
Inner resources of the body always present. Let's focus on that. Absolutely love that. I can't wait for your presentation, Anna. It sounds really like a paradigm shift, and there's so much to learn for us there. So thank you very much for being here with me today. And we're all looking forward to your presentation, Distress and Labor, a Psychoneuroendocrine approach. And you will be live on February 18th. So thank you so much, Anna.
Thank you, Kristen.
And some information for our viewers now. This presentation is, of course, part of our Gold Midwifery Online Conference 2025. We'll get started next week with our open access keynote presentation that anybody can enjoy and sign up for. So please visit goldmidwifery.com to find out more. And we hope to see everyone at the conference. Thank you, everyone, for watching, and have a lovely day wherever you are in the world. Bye-bye for now.